Welcome back. We are answering your questions about COVID-19 with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. This person says, my parents are 86 and 90 years old. We're all vaccinated. Is it okay to fly on an airplane to visit them, considering the Delta strain is so high?
So when it comes to flying, I am a fan of making sure that you're doing all you can with like your personal protective equipment. So definitely masking. I would avoid, if it's a short flight, I would avoid taking down your mask at all, and maybe just drinking and eating before you get on and using the restroom and then going from there, and making sure to using hand hygiene and avoiding touching your eyes or your nose or mouth after touching the airplane surfaces.
Mm-hmm. But you think that the visiting, since they're both vaccinated, is okay?
Yeah, I would, making sure that nobody has symptoms, and it depends on what you do on your day-to-day life, ensuring that you're wearing a mask if you're going out indoors to areas where there may be a lot of folks who are unvaccinated.
All right, this person is asking, how effective are vaccines for transplant patients?
So there have been studies looking at transplant patients, their immune response to those vaccines, and unfortunately they're not great, and I think we had a sense that would happen. So transplant patients usually are on some significant medications to lower their immune systems, and so we anticipate that also may happen in other patient groups, be it somebody's undergoing chemotherapy and affecting certain parts of their immune system. So that is in part why it's so important for everybody else to get vaccinated. We're really trying to protect all the vulnerable patients and people in our community. And it might turn out that folks who are transplant candidates, who've had transplants or are immunocompromised by certain criteria, they may be the ones who would benefit the most from getting a booster vaccine.
All right, so this person is saying, why would fully vaccinated people need to wear a mask or be afraid of being around unvaccinated people?
So I think it just really depends on many factors. If you're it depends like how long you've been vaccinated. We don't know the durability. We suspect it is still pretty good. And however, if there are several folks who may have COVID in the arena you're in and don't have a mask, potentially you probably will get exposed and might get a mild version of the infection. The vaccine is very effective at preventing severe disease and hospitalization, but we suspect that it really depends on your exposure, and you may get mild disease.
Mm-hmm. This person is asking, do you need to have the flu shot if you've already been vaccinated for COVID?
The COVID vaccine is really targeted to the coronavirus, the SARS-CoV-2, whereas the flu vaccine is targeting the influenza strains from last year or the year before. It is still a very good idea to get boosted, to get a flu vaccine this fall and winter, because we suspect there will be circulating flu this year.
This person says, my 90 and 92-year-old parents had COVID and the antibody infusion. My dad still feels a little weak. Should they get a vaccine?
Yes. Even though somebody has natural immunity from getting COVID even recently or even this past winter, you probably have had some immunity to protect against reinfection, but especially with the new Delta variant, we're seeing reinfections in folks. So we definitely recommend folks to get their vaccines, and it just boosts their immune system even more so.
Okay, quickly, I have year-round allergies. Is it safe to get the vaccine?
Most likely so. The only concern we have is folks who are allergic to the components of the vaccine. So if you have your questions and see an allergist, they will likely can answer those questions too.
Yep, make sure you check with your allergist. Thank you so much for your time and your expertise. We so appreciate it. We want to make sure that you know that all of these segments are going to be in the Two Wants to Know section.